People are spread out well over a mile between Representative Gary Peters' office and Troy City Hall. I came down here specifically for that fine sign right there.
Oh, did you really?
That is a fine sign.
Yes, it is.
Yeah.
Put it on, not going to show any of her mob violence.
Oh, you think there'll be any? I don't.
We're at the peak right now, I think.
Well, actually, the objective of taking these videos is to demonstrate that this is regular people, right? These are your neighbors, and anybody who's gone to these always feels better after having a conversation with people like yourselves. Absolutely, because you feel like you're alone, right? At least I did, until I came to a couple of these and said,
Who brought these people all over here?
what's that?
Who brought y'all over here?
We all drove over individually. Go ahead.
Well, I just happen to be walking my dog.
Nice dog.
And she's in favor of healthcare reform too. But
You know, you're very thoughtful and articulate and polite, not like I've seen town hall type attendees. In fact, I don't see anybody misbehaving here today.
Well, you know, I just think people are frustrated because they don't have someone who will give them a common sense, a direct answer. And so I can understand why they become upset, because we're talking about their parents, their children, so they're understandably angry. I think it's the job of the representatives to communicate what's in this bill. Our president hasn't communicated it, and I'm deeply concerned that if he can't even explain the bill, what are we going to get?
All right, you don't look like the type of person that comes to a lot of protest rallies.
No, this is my first time.
What do you think?
I think it's great. I'll come again.
Did you talk to any interesting people?
Oh, I did.
How did you find out about this?
To my son.
Did you vote for Obama?
No.
Did any of your friends vote for Obama?
I'm afraid so.
You
relatives.
You think they're sorry?
They won't admit it. We'll put it that way.
Okay, all right, that's fair.
Yes.
well, my husband he died last November. He was the chief of neurology at Beaumont Hospital for 20 years, and prior to that, he was chief at Harper, where he treated the poor for free every Wednesday. He left England because under socialized medicine, he was not able to treat patients the way he wanted to. In fact, in England today, they let you go blind in one eye before they give you a pill for macular degeneration. If you have cancer, you have to wait 8 months to have it removed for a colonoscopy.
Now, you know, when we hear stories like that, we think it's made up. It couldn't possibly be true.
It's not made up. My husband, I think, loved England every bit as much as America, if not more. The only reason he left was he loved his patients. He wanted every patient to have the best health care possible. And he wrote Basic Neurology, which is used around the globe. I mean, it's very prominent in his field. And he was all for helping the poor, but not through socialized medicine. You know,
And I grew up in Canada, and we had to, it wasn't unusual to have to wait months if you wanted to see a specialist. I went to nursing school there, and what happened in the 1980s was the provincial government tried to contain healthcare costs and they decided to cap doctor salaries. That resulted in doctors coming south to the U.S. That resulted in a shortage of not just primary care doctors, but specialists.
Yes.
And it was common for ERs to be clogged with people who would just come in for simple things like having to refill a prescription because they couldn't get into their primary doctor's offices. And in 1992, I was diagnosed with leukemia. I had to wait 7 months and drive 200 miles to see a hematologist because there were no hematologists in Windsor, and I could have died in that 7 months. And
Give me trouble. I ended up in the cardiac unit, and I had lots of tests, and I was fine. But unfortunately, my insurance didn't cover over $11,000 of that bill. But I would rather pay that $11,000 knowing that when I need to, I can take my children like you were saying, immediately to the specialist. And I've done that when a primary care physician didn't think it was necessary, and it turned out it was necessary. My son had erosions in his stomach, and the primary care physician thought, well, you know, it's really not necessary to see a specialist. I don't know if you need a test for that yet. Well, you know what? He did have erosions.